Hello and welcome to my service learning presentation. My name is Alexander Lopez and I did my service learning education at Gentiva Hospice. This was in Visalia, California at the Central Valley at the office building. The goal of the organization is to make sure that patients are ready for death and to pass on comfortably. I was responsible for three things while I did my hospice journey. I did tuck-in calls, I answered the phone, and then I made cookies for the hospice patients. Communication strategies to become a better communicator. OT communication strategies. I did active listening, empathy and validation, respect, autonomy, dignity, emotional, and spiritual sensitivity. For active listening, we gave full attention, we maintained eye contact, we leaned in slightly forward and make touches to the knee to show that we're understanding and validating what they're saying. For empathy, we acknowledged emotions and used calm and warm tones. More specifically, when I was talking to the patient family members or the new patients that walked in the office building or any of the family members, it's very important to know that we use empathy and validation and that we're using calm and warm tones. These people are passing. We want to make sure that they feel comfortable. We want to make sure that the families, because they're grieving, that we are acknowledging that they're going through a hard time. Respect, dignity, we asked open-ended questions just to continue to have the conversation continue on. An emotional, spiritual sensitivity, just be aware of the topics related to the end of life and the legacy and beliefs. Lead patients and lead the patient's discussions. Let the patients lead the discussions. Here's me right in front of the Gentiva Hospice building. I went there. That's me, therapeutic use of self. How I used therapeutic use of self. So there are three main ideas that I had used. I used empathy. I used this when making my tuck-in calls. Tuck-in calls is when I got the list of everybody on the census of the hospice company, and I called them to make sure that they had if they needed any medication or supplies needed for the weekend. When speaking to the patient families over the phone, it's important that we speak with empathy as the patients in this field are passing away. That's very important as I learned through this hospice journey that everybody is grieving. Everybody's in a process where these patients are passing on and they're walking into death. So we have to be very careful. We can't just come out full blown and talk to them like they're just somebody off the street, right? We have to use empathy. Communication is big. We use communication and empathy together. We're using a very soft and respectful tone. This is what gets our point across and how we communicate effectively. Adaptability. It's important to know that what situation we're in and what needs the patients are going to need whenever you're on the phone with them. So if they say that they need amoxicillin or whatever medication, you need to be able to adapt and write it down and make sure that we get a nurse out there. That's how we adapt in this particular setting. That's how we have to be adaptive. Occupational demands. It's important to know that in hospice occupational therapy, the focus isn't in restoring lost function, but it's to optimize participation in value occupations, reducing burden, and promoting dignity until the end of life. Occupational demands, there's physical, cognitive, emotional, environmental, spiritual. Here's a little just a summary. This is a very important time for the patient and its family as the patient is passing and actively passing away. Things to take into consideration, not necessarily the demands, but different cultures treat death differently, so objects and feelings and the occupational demands may be different from person to person. This one makes it very diverse. One, the physical demands, hospice patients are passing away, energy consumption is low and fatigued, pain management is a key factor. Cognitive demands, memory may be impacted by medication, decisions may be made by the family members. Emotional demands, families and patients are grieving and learning how to cope. Environmental demands, comfortable access to aid and minimum overstimulation. You don't want a lot of things going on. You don't want a lot of sounds. You don't want everybody intruding in the area playing music unless the patient wants it, right? But they want to be very comatose and they want to be They want to rest. Their body's going through a lot. Like the physical demand said, they're physically ill. They're physically fatigued. They're resting. You don't want chainsaws and construction crew coming through because it's going to make them overstimulated. Spiritual demands, whether they're religious, we want to hold them to their personal beliefs and their end of life wishes. Interprofessional collaboration, a term-based approach to patient care that involves healthcare professionals from different backgrounds working together to achieve the same goals. So the IPC team is very important when introducing the hospice topic to families. It may happen in different settings. Whether you're at a skilled nursing home, whether you're at a hospital, whether you are at home, when the time comes and you are ready for death, hospice is a good option to make sure that you're comfortable. But in the event that you're working at a hospital of some sort, there is a team that you can talk to for resources. I made a little chart here by myself. Medical director. This is in their goals: nursing staff, social worker, therapy representative, dietitian, and it has their goals. Potential programs. I like this chart here. I found on the internet. It's just who the patient is. You want to maybe as an OT practitioner, we want to implement a program that or an intervention that we can reflect on the person's life if they wanted to. So yeah, I made a program where we could make a tree or a collage that talked about the life of the patient and their hobbies, what they did for fun, and just reflect on the time that they were doing well. Social and occupational justice. So the core aspects of social justice is equality, access, participation, and rights. Equality, hospice is provided for those of all shapes and sizes, race and color, religion. Care plans are tailored for each patient, comfort level, and cultural belief. I would say that you don't have to be dying. That's not always the case. Like you can, there are special circumstances where people go on hospice where they're just there for pain management, and people do graduate from hospice, so that is an option. Access. All patients at hospice have the access to assistive devices, home medications, and supportive services, regardless of income, location, insurance. Participation. While you're on hospice, patients continue to do things that bring them joy and meaning. They have the access to family meals, faith, rituals, or anything that the patient wants to do. And rights. We respect the families and the patient's rights of health and wishes. We protect their dignity. For core aspects of occupational justice, we have empowerment, inclusive classification, enablement, and respect. So empowerment, patients have the right to choose the health and how they want to spend their time before they die. Inclusive classifications, occupations, just do occupations and interventions with them. Hold their hands, tell stories, or do anything that they want to do. Any meaningful activities that's personal to them, let's do it. Enablement, modifying tasks so patients can still participate. They're able to, just because they're ill, it doesn't mean that they have the right to not participate in activities. They have a right to, we can modify tasks so they can participate. Respect, although patients may want to rest and stay in their choice is theirs, that if they want to do activities or anything. Conclusion, overall, the experience was very saddening. It was a very sad environment to be in, being in a room with the patient that were passing away. I truly feel that this is not an environment that I'd want to do OT in. That's just me. Maybe it's tailored to some people that would like to, that are into that, but not myself. Some of the key ideas that we used, I used a lot of therapeutic self through active listening, especially when I was on the phone talking with families. I was able to get good communication skills and be an active listener. I believe I participated in the division of administration of the organization, as well as making those calls to make sure the patients had everything that they needed. This site was 100% meeting the occupational needs of the individuals in hospice care, and it met all the categories of needs of empowerment, autonomy, and respect. The way OT can contribute is by giving good, meaningful activities and reflect on the life of the patient. Interventions that just help them cope with this hard time, and as well as the families, and just get a good time and make sure that the end of the life wishes are being met. Thank you so much. These are my references. Thank you so much for joining me, and thank you for allowing me to show you my Gentiva hospice experience. Thank you.